We've been doing awake breast augmentation in the office for a couple of years now, and basically what that means is we're doing it under a local tumescent anesthesia type process where we're using this fluid that basically has lidocaine or numbing solution, and we numb the breast area with this fluid and provide anesthesia without other forms of anesthesia. Most of the patients do very well. They have very little, if any, pain during the procedure. They may have a little sensation of pulling or pushing or pressure, but they really have very little pain or discomfort.
I decided to get my breast augmentation done by Dr. Caruth because I've seen his work, and after all the weight that I lost and my two babies that I had, my breasts were very saggy, and he was able to go in and place 2 implants in there and build them back up to what they used to be.
I chose that procedure because I felt it was safer. There's no anesthesia, general anesthesia involved. So there was no recovery from having to have been under anesthesia, and I felt really engaged in the procedure because that's such a sensitive topic for women that I felt comfortable when I left with what the results were going to be. I didn't have to wake up from anesthesia and be like, oh my gosh, that's not what I wanted. I was informed throughout the procedure, and I was comfortable that when I went home I was going to be pleased with the results.
You're able to go home quicker. I was up and walking that day, taking a shower the next morning, and there's no downtime. You're able to get up and move around and instantly start getting back to the way you were living.
They still have post-operative pain from muscle strain and those types of things, but they don't have the nausea, the vomiting, the post-op side effects that may go along with another anesthetic. So I think overall they do recover quick, and they do very well, and they get to participate and really have an input into what they're having done.
The procedure is fantastic in the way that you can pick your own size, because you can sit up and you look at what you want, and he's able to change it. We actually changed it a couple times, and then I was able to pick exactly what I wanted.
Dr. Caruth definitely helped me feel better about myself. We live in a time and a place where there's a lot of scrutiny on those things, and so I'm not only just for my own personal feeling better about myself and my clothing, feeling better about myself professionally. It's been a really good experience.